Hi everybody, Chris Hayes here from Hayes Physical Therapy in Paoli, Pennsylvania. We often see patients with shoulder pain. Oftentimes it's a shoulder impingement, which is a pinching of the rotator cuff tendon as it makes its way under the acromion. And so very painful condition, can be definitely painful when somebody raises their arm up in front, out to the side, even reaching behind the back. Treatment for that is definitely something that you want to jump on early so you prevent a frozen shoulder. If you're not using that arm because of pain and you're not sure what to do and you stop using it, you're going to get into a bigger problem. So I'm going to give you a couple little tips, assuming that you have shoulder impingement. Even a partial rotator cuff tear is something that you can do these exercises with. First thing is impingement and even partial tearing can occur when somebody has poor posture such as this and they're going through their day like that. So what's happening is the shoulder blade is actually collapsing down on that tendon. Biggest one is supraspinatus, which is one of 4 of the rotator cuff. And it can start to inflame that, and it can also get a lot of scar tissue that builds up on that over time, or it can start to tear it. So this kind of posturing, it'll also restrict your ability to raise your arm. You can't go any higher. But when we pull our shoulders down, we have the range of motion becomes more complete. So a couple quick exercises. So Tyler, I'm going to have you put your arm behind the back. So as soon as you do that, you're going to find an area here in the front that becomes very, very tender. It's where the point where the biceps and the supraspinatus meet. Can you feel that in there? And so what I'm going to say is bring a little blood flow to that. Get your index finger and your long finger and just do a little friction massage with your opposite hand. So you're coming across, you're going to find that area that's tender. Do you feel that? Mm-hmm. And you're going to do that for about 3 to 5 minutes a couple times a day. So keep doing that. So what does that do? Supraspinatus gets some blood flow, but not a great amount of blood flow. So as you know, you need healing. It involves having more blood flow to the area. So that is actually increasing the blood flow, and it's also desensitizing that tendon. And if there is any scar tissue, it may be breaking some of that down as well. So that's the first thing that you can do for shoulder pain and impingement is that particular move behind the back, 3 to 5 minutes. Okay? Second thing is stand for me, Tyler. And then let's turn this way and just put the arm behind the back, just as you were. And we could see that he's a little tight. When he does that, he actually rounds those shoulders forward. Draw those shoulders back, and then just reach the arm up and down like you're scratching your back. Up and then down. And when you do that, try to keep your chest up, and you may not go as far, so try that for me 5 to 10 times. Up, good, and then down, good, up. You feeling that good stretch with that? Good, yeah. And down. And if you're also, keep it going, somebody who works out in the gym, as Tyler does, and you're working a lot of the front of the body, this is going to be super tight in here. And so definitely this is going to be a good stretch, okay? So that's the second exercise, internal rotation actively. Now take your arm away from that. Third exercise, Tyler, turn around and face me. You're going to take this behind the back, little wand, could be a towel. First part is you're going to down to the floor. Second part is roll the shoulders back. Third part again is to lift off, designed for posture. So, so part 1 is depress knuckles to the floor. Down they go. Now roll those shoulders back. Before you lift off, wait, you skipped a step. Knuckles to the floor, push down. When he does that, keep your body up nice and tall. When he does that, actually gaps the space there. So that's really great. So knuckles to the floor, then bring the blades together, pinch them together. Then the lift off is the third component without coming forward there. Okay? 1 to 2 breaths and down. Knuckles to the floor, roll the shoulders back, and lift off. 1 to 2 breaths. Okay? Real good. Again, opens up posture. Okay? That's the third exercise. So a wand or a towel, shoulder extension. Now for the bonus, a lot of you also ask about what's the best sleeping posture for your shoulder because it hurts to lie on it, and I wouldn't recommend lying on it. Again, when you lie on it, you cut down that blood flow. It becomes very painful. Okay? So Tyler, I'm going to ask you to lie on your back instead. And when he's lying down in this position, you can obviously see that his shoulder is up here and his elbow's down here like a seesaw. that'll put stress and strain on the front of that shoulder. So we want to correct that. So a towel roll works really nicely just to prop that up so that these guys are in the same plane. That should give you a much more comfortable night's sleep. So that's what you need to do for shoulder impingement. Our practice sees a lot of it, so if you're having trouble with it, give our office a call.